When it comes to people making the personal choice to go have cosmetic surgery, and I want to disclose I have had cosmetic surgery. I had a nose job in Dubai a few years ago. I was living there. I didn't fly there for it.
Okay.
There you go. That was my recovery. Very painful. I went for a medical procedure and they took off the bump on my nose while I was in there. No regrets at all. I think anyone should pursue cosmetic surgery responsibly if they want to. It can be absolutely life-changing, Esther. But in terms of flying somewhere to go do it, what are your thoughts on that?
I think if you understand the risks and you are prepared for what comes with it, I think that's fine. I think in the context of the NHS, because we're talking about it in the context of, the NHS having to foot the bill for botched surgeries, I think that's a reality that comes with socialized healthcare. I mean, if we really want to get to the crux of the issue, we should be talking about obesity and alcoholism, because these are choices that, people make. Well, in the case of obesity, you can argue that it's linked to mental health, but at the end of the day, getting to that state is because of personal choices, and yet the NHS spends most of its budget on, rectifying lifestyle-related illnesses like this. I think £1.7 million for botched surgery is actually a steal. If we could exchange that for all the, costs that we spend on, or the amount of money that's spent on, lifestyle-related illnesses, I think that the NHS would be in a much better state. But the reality is, at the end of the day, people have to take personal responsibility for the choices that they make. You could go to a country where you don't have any social support, you don't have any, relatives around, aftercarers may or may not exist, and that's a risk that you take by going abroad to get surgery. So these are all the things that people need to consider.
Absolutely. And do you think, by the way, that there should be any advisory from the government or from health bodies or from plastic surgery associations about Turkey, based on what we're hearing?
I don't think necessarily, because yes, we usually use the example of Turkey because it's so popular and common. But increasingly people are going to India for sort of eye surgery. The Middle East, Dubai, I've heard of as well. So I think Turkey, just because of it's what we know. But there are other places as well that people go to. At the end of the day, I think we've become so infantilized as a society that I don't think it's necessary for the government to say this is your responsibility. But I do think if we're concerned about the repercussions with regards to the costs on the NHS, we really should be talking about obesity and alcoholism as opposed to, botched surgeries.
Dr. Guven, I want to end this discussion coming back to you because, again, you're not representative of all cosmetic surgeons. You weren't related to the botched surgery we were talking about earlier on in the show, but want to ask for your advice to anyone considering flying not just to Turkey, but to somewhere else in the world for cosmetic surgery. How should that be done responsibly?
I just want to recommend to the people, UK people, just first time, they should make interview with the surgeons, real interview, live, because they need to see the environment and the hospitals of the surgery going to do. So it is very important to talk with the surgeons. It's not fine to share the photographs and have some surgeries about the photographs. You need to talk with the surgeons and interview with the surgeons, consultation, and later decide about the surgery in Turkey. It is very important, and the first thing that we advise for the UK people. If you come to Turkey and see the hospitals, if you look around the hospitals and the environment, the sterilization, and especially the physicians' experiment is very important for the successful surgery result. It is very important.
Do you think your cosmetic surgery industry is a positive part of Turkey's reputation?
Yes, because in Turkey, there is many physicians that's well educated in plastic surgery. So you can find very, very high-end surgery procedures in Turkey, and many surgeons have a very good reputation in Turkey. If you can find good surgeons, you can have good result as well.
Of course, but there are always, of course, examples of stories like we had from Sarah this evening as well. I want to thank particularly our two case studies who've shared their stories with us, Sarah Platt and Dinzel Seegers. Dr. Guven, for your insight. Esther here in the studio. Thanks.